Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Rajalakshmi R, who is a very popular gynecologist obstetrician of Udupi and Karavali. She is the past president of IMA and the present president of Gynaecologist Society of Manipal. And today happens to be the World IVF Day. And that is in 1978, Louis Brown, he was born as a first test tube baby in the world. And that's how they are celebrating the World IVF Day. So let us learn from Rajalakshmi what are the causes for this sterility and how to overcome that and what are the investigations. Welcome, Dr. Rajalakshmi.
Yeah, thank you, ma'am. Thank you for the opportunity. Yes, we are celebrating World IVF Day today, In Vitro Fertilization Day. It is celebrated to create more awareness and to seek help whenever they are suffering from subfertility or infertility. Infertility these days is seen more commonly than previous days. 1 in every 6 couple is seen to be they are finding it difficult to get a baby or children, to conceive. Yes. If we think why this number is increasing these days, first is the delayed age at marriage. When we delay the age, the capacity of the sperm as well as the egg, the number and their fertility potential comes down. So that is one of the main reason. Second reason is the lifestyle, which is mostly sedentary, sitting job, desk jobs, decreased activity, and the food habits what we are using now, decreased sleep, more stress. This also causes. And then there are some chemicals which we call as endocrine disrupting chemicals, which are there in the day-to-day use, daily usage.
Junk foods also contain that. Junk foods also.
Yeah, junk food which contains more processed items with preservatives, with coloring agents, and mainly the thing is plastic. It is there even in the dust.
Yep. Microplastic, yes.
Microplastics, maybe because of the vehicles, more usage of vehicles, vehicle particles are all plastics.
Yeah.
So this microplastics, and then we have some cosmetics which are phthalate and parabens. These things will cause some disruption.
What about the men going to the gym and having six-pack? They are also getting infertility. What is the cause for that?
Yes, they are trying to exercise, but along with the exercise, they may to want to bulk up to make muscle mass. So they might be taking some supplements like anabolic steroids or some testosterone injections or the protein what they take after pre-workout, post-workout and all. That might contain some chemicals which are deranging the hormones in the body. So that is also one of the causes for increasing rates of infertility.
Yes. And sometimes they take the injection testosterone also, So what happens to their natural testosterone?
Yeah, when we are given injection in testosterone from outside, like we have some negative feedback mechanism in our body which controls. So the normal testosterone in the body will come down, and the number of sperms and the some factors will come down. That's why they will have infertility. So whenever you making muscle is okay. With the exercise only they can make the muscles, but extra supplements you have to be very careful to see that they don't have any harmful chemicals in them.
Yeah, because they don't know what is there in the formula, and the energy drink and all those things are very
excessive sugar wherever it is there, that also affects.
All the energy drinks have the excessive sugar and caffeine. And which will not allow them to sleep, and then again sleeplessness and problem.
Yes. Sleep is the one more major factor. Sleep needs to be there to maintain the circadian rhythm of the hormone. That means we have some rhythm in the hormone secretion. Some come in the daytime, some come in the night time. Especially we have to have melatonin in a certain concentration so that the fertility hormones do their work very well. So if we are not sleeping on time, screen, especially just before sleep, we think that we have switched off the mobile, kept it away, but our mind keeps working.
To get the sleep and then get back to the thing, it will take another few hours.
Another few hours. So that also affects the fertility potential. Same way.
This
So
infertility
another
is
thing,
both in men as well as women. Is it right?
yes, both in men and women. And excessive like weight. Some have lean weight, some have excessive weight. Both are the problematic ones for the fertility.
Okay.
Obesity also can cause some diseases like hypertension. It can come along with hypertension and diabetes.
Hypercholesterol. Yeah.
Dyslipidemia, that also affects the sperm and egg quality. So that is also delaying. And the pollution around, air pollution, water pollution, mainly the plastic, that is also delaying. And last one, but the most important one is the stress, mental stress. We
Very
are always
important.
in a
Most
hurry.
important. Yes. Yes.
Yeah, we are always in a hurry. So this hurry again dysregulates our hormones and makes it difficult for a couple to conceive. So these are the
Okay.
various factors. Now
Okay.
that is
How
that
do
that
you
is
investigate? Now, so many causes are there. How to make out which is causing the infertility in a particular couple?
Yeah. So we have to investigate both of them, the male factor and female
As well as
factor.
the
Male
wife.
factor
Yes.
is about 35%, female factor will be about 35%, and another 30% will be unexplained, where we can't find any cause.
Okay. Okay.
Though to investigate the male factor, we have to see whether it is a decrease the production of sperms. So we have to do a sperm count or semen analysis. That gives us many factors about the structure, function, and the
Motility.
fertility potential of the sperms.
Sperm.
Then we'll have to do some hormones. If we find less sperms, we have to do a hormone profile in them. We might have to do a ultrasound. They may also have some obstructive factors where sperms are formed but they are not coming out. So that also has to be investigated. So
Okay.
this is in males. In females, we have to see what is the cause. To see again, we have to do a blood test to see the all the hormone profile. Mainly, we do anti-Mullerian hormone. This says as the number of ovarian reserve, how much of the ovary and eggs are there, how long, how nowadays. Last week only one lady came to me, ma'am, asking, I want to see how long I can push away my pregnancy. I want to see AMH, or how much time I can buy. So there's social media these days, and everything is out there. But
Okay.
so we get questions like this. See, AMH is one of it. There are many other factors which affect your fertility. We have to do a scan and see how is your uterus. Is there any malformation? How is the ovary? Is there PCOS or PMOS? Then we have to see the tubes, fallopian tubes, where there is any block,
Any obstruction. Yeah.
obstruction are there. Then there can be some immunologic factors, like there can be some antibodies in the cervical mucus or cervical secretion, which will not allow the sperm to enter.
Sperm to
So
get
that
inside. Yeah,
get
it
inside.
prevents. Okay.
Yes, so we have to
Oh.
do something called post-coital test. We do. So there are various things we have to do and then decide what can be done. Only thing is I want to mainly stress on the fact that when a couple comes with infertility, it is a shared problem. It can be there in both. The
Both
fault
the
can be
husband
in
as well as the wife.
a wife. Sometimes it can
No,
be there
but
in
this
both
is
of them.
very important to understand, because in olden days, if they were not getting, they used to get married to another lady. The
No.
effect is in the man, but by getting married to another woman or another woman, that problem is not going to be solved.
It
Yes.
is not the solution. So
Yes.
both have to be investigation and both have to be treated accordingly. If there is a
Okay.
simple factors, we can try with some tablets and some hormone injections and all that. If they don't conceive, then we go to something called IUI, intrauterine insemination, where
Okay.
we insert the semen into the uterus of the
Uterus.
lady.
Yeah.
Okay,
And
but
that
when there
semen can be taken from anyone. It
are
can
no,
be
there
from the husband also, or it can be from the others, because I have seen
husband or
earlier. Yeah.
donor, we
Donor.
have ART rules. We have to go through that. Artificial
Okay.
Reproductive Technology Rules Act is there. Based on that, we
Okay.
have to do many consent and everything is there. So it can be done if there is a decreased sperm count. If that doesn't happen, then we go to IVF, that is in vitro fertilization, where we make the gametes meet outside the body. The egg and sperm meet outside the body. We see to it that they become an embryo, it becomes a blastocyst, and then we insert into the uterus of
Back
the
into the
lady.
uterus. Okay.
Yes.
So it is
Then
basically they unite and they grow in the test tube and then they are
test
put
tube.
into
Yes,
the
yeah.
thing.
That's why
And
it is
that's why
called a
they called
test
it
tube
test
baby.
tube baby.
Test tube
Okay,
baby.
okay.
And then next we have something called ICSI. ICSI is intracytoplasmic transfer of the sperm. So where the sperm is very defective. Very defective means it is doesn't have motility and all. Then we inject the sperm directly into the cytoplasm of the egg. It is an advanced procedure.
Oh,
And there are
wow.
many, yeah,
Okay,
advanced that
but
we
there
do.
won't be any
Then
deformities.
no, that is
Okay.
also there. Good question you asked me, ma'am. Before inserting it, we are transferring that embryo transfer. There is something called as pre-genetic testing, PGT.
Wow,
So
wow.
this usually we do in a lady who has multiple abortions or who has some chromosome link disorders, either
Okay.
autosomal dominant or recessive. For all
Okay.
those people, if they are consanguineous marriage and there is some
Hmm.
problem in the family,
Hmm.
so it is again under the law. We have to again
Very,
take
very
so much
strict.
consent and
Okay.
everything,
Yeah.
so much of forms to be filled. So there is something called as implantation genetic diagnosis, PGT we
Okay.
do. Only when the embryo is fine, then we insert.
Okay.
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 And sometimes there are complications of this also. Complication is we might have multiple pregnancy.
They not only one, the double, invariably IVF, they have twins. And I have
Yeah.
seen triplets also.
Yeah, it can be triplets or sometimes quadruplets, but usually if they're higher order pregnancies, we have to, IVF specialists usually reduce them. Make it
Okay.
two because two is easier to manage. Three, four is very difficult to manage.
Very hard. Yes.
Yeah, so that is what.
Because the weight will be very less and then, managing
Yeah,
them with the
after.
low is
In
quite
advanced
challenging.
countries, we can manage them. In India also, there is the
No,
quadruplets and
up
all are
to
happening.
800 grams they can, but otherwise if it is too less quadruplets, it's very difficult.
Yes.
Okay,
Okay. So
okay.
this is in vitro fertilization. But
Hmm.
the factor here is also one more thing I would like to tell. They need lot of counseling. Every IVF doesn't succeed. The success rate is only 40 to 60% in the good best and best of the centers also because we are trying it artificially. It is
Yes.
not happening naturally. So they have to be counseled about that. Next is about the cost. It's very costly
Yeah,
because
very
we need to
costly.
give so many injections are needed. We have to create such sterile atmosphere outside. See, then small infection also can't happen. We have to prepare that egg, the embryo in such a sterile state. So it will cost. So cost is
So
another factor.
in other words, Rajalakshmi, what you're telling is IVF is costly, whereas alteration in their lifestyle is easier.
Easier,
And
yes.
easier and less cost. And
Yes.
not getting into the bad habits, leading a very healthy life, and then
Yes.
not taking the formulas or energy drinks in
Yes.
the gym. All these things are very simple ones, and
Yeah.
they can
Yeah.
get away with that. So having good
Healthy,
sleep, healthy sleep, healthy living, and
healthy
healthy
lifestyle,
lifestyle. Yeah.
mild exercise, 150 minutes per week, then good sleep, peaceful mind, along with the right age to conceive, they will be happy. But
Correct.
everything cannot happen. Some people may need assistance for their health. Always the artificial reproductive techniques are there. They can make use of that.
Yeah. So ultimately, we are wishing a very, very happy, healthy progeny for all our
All of
viewers, so that they don't have to go for the costly IVF and other things. So thank you very much, Raj Lakshmi. I'm sure if viewers have any questions, they can ask Dr. Raj Lakshmi and get their answers. Thank you.
Thank you so much, ma'am. Thank you for the opportunity.